Are you tired of managing pain with pills that mask symptoms while your daily movement keeps shrinking?
Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster, and today we're looking at acupuncture as a time-tested, drug-free option for chronic low back pain, especially in older adults. Chronic low back pain affects mobility, independence, and quality of life, and it's a driver of opioid prescriptions and misuse. The question is whether a safer approach can deliver lasting relief.
I'm Alara Sky. Acupuncture has been used for centuries, and modern research has steadily validated its role in managing chronic pain. Since a 1997 National Institutes of Health consensus statement recognized evidence for pain management, clinical trials and guidelines have expanded, giving you a clearer path to try this therapy with confidence.
A recent large randomized clinical trial funded through the NIHHEAL initiative enrolled 800 adults aged 65 and older with chronic low back pain. Participants were assigned to usual medical care, standard acupuncture, or an enhanced course with additional sessions. Standard acupuncture involved 8 to 15 sessions over 12 weeks. The enhanced plan added 4 to 6 sessions in the following 12 weeks.
At both 6 and 12 months, the acupuncture groups reported greater improvements in pain-related function than usual care. People walked, bent, and completed daily tasks with less difficulty. Anxiety symptoms fell as well, and adherence was high, with more than 80% completing the recommended minimum sessions.
Safety was strong. Serious adverse events were rare and similar across groups. Minor effects like brief needling site discomfort were reported by fewer than 1 in 10. Importantly, the relative benefit on disability persisted at 12 months, supporting acupuncture as an effective and durable option for older adults with chronic low back pain.
Understanding why it helps is useful. When needles stimulate skin and deeper tissues, nerve signals travel to the spinal cord and brain, adjusting how you process pain. Your system releases endorphins and related peptides that reduce pain. Acupuncture also modulates immune signals by lowering pro-inflammatory cytokines and increasing anti-inflammatory ones.
When practitioners elicit Dai-Ki, a dull ache or mild electric sensation, nitric oxide rises locally, improving microcirculation and analgesia. Brain imaging shows decreased activity in limbic regions tied to pain and emotion, which aligns with reports of reduced pain intensity and improved mood after treatment.
Evidence extends beyond back pain. The World Health Organization has summarized mechanisms that include triggering natural opioids, influencing the hypothalamus and pituitary, and shifting neurotransmitters and neurohormones. In outcomes research, acupuncture relieves chronic pain in roughly 55% to 85% of cases, far above placebo and approaching morphine-level effectiveness without the dependency risk.
Large trials reinforce this. In knee osteoarthritis, a 26-week Phase 3 study found about a 40% reduction in pain and a 40% improvement in function with real acupuncture versus smaller gains with sham procedures or self-care alone. A pooled analysis of 29 randomized trials with 17,922 patients showed acupuncture outperforming both sham and standard care, with meaningful pain reductions.
If you're considering acupuncture, start with a clear plan. Speak with your primary physician to review your history, medications, and conditions like pregnancy, bleeding disorders, cancer, or anticoagulant use. This step ensures you pursue treatment safely and in coordination with your broader care.
Next, choose a licensed practitioner. In the U.S., look for LAC credentials indicating state licensure or national certification. Outside the U.S., check local boards or traditional medicine councils. Sessions typically last 60 to 90 minutes, including evaluation and 30 to 40 minutes of needling.
Expect variability. Some people notice relief after a single session. Others require several visits. You may feel relaxed, tired, or more energized afterward, and observe changes in sleep, digestion, or mood. These responses reflect how your system adapts to the treatment. Consistency across 8 to 15 sessions over about 3 months is common for chronic low back pain.
Acupuncture fits alongside other therapies. It complements physical therapy, exercise, and prescribed medications. It is not a DIY practice and relies on sterile, single-use needles in a clean setting. With a coordinated plan, you can integrate it into weekly routines wherever you live.
If acupuncture access is limited, several non-drug options can support pain management. Curcumin can reduce joint pain and improve mobility. K-laser therapy applies infrared light to decrease inflammation and speed healing in musculoskeletal conditions. Chiropractic care can improve alignment and mobility for back and neck issues.
Mindfulness and meditation alter pain processing and can reduce pain intensity with minimal side effects. Massage therapy has demonstrated benefits across multiple pain conditions and can improve anxiety and quality of life. Emotional freedom techniques use fingertip tapping on meridian points with verbal focus to calm the nervous system and ease tension.
Daily habits matter. Keeping linoleic acid under 5 grams a day helps minimize inflammation and mitochondrial stress. Avoid LA-rich seed oils such as canola, soybean, corn, safflower, and sunflower, and be cautious with processed foods and restaurant meals cooked in these oils. Also avoid non-organic chicken and pork, which tend to be higher in linoleic acid.
Cut back on grains and refined sugars to lower inflammatory inputs. Add high-quality omega-3 fats, such as krill oil or wild-caught fish like Alaskan salmon. Get regular, sensible sun exposure to support vitamin D, which plays a role in pain and immune function. Each of these actions reinforces what you gain from acupuncture.
Frequently asked questions have straightforward answers. Acupuncture is used for pain, but also supports issues like nausea, stress, digestive problems, headaches, and insomnia. From a Western perspective, it stimulates nerves and circulation, boosts natural pain-relieving chemicals, and can reduce inflammation by influencing compounds like adenosine.
How many sessions you need depends on your condition. Many plans target 8 to 15 sessions over about 3 months, with progress checks built in. For older adults, safety is strong when treatment is provided by a licensed professional. And yes, it combines well with other approaches. Just make sure all providers know your full plan.
Here's your challenge. If low back pain limits your day, schedule an appointment this week with your primary physician to discuss acupuncture, identify a licensed practitioner, and map out an initial 8 to 12-week plan. Track changes in walking time, sitting tolerance, and daily tasks so you can measure results as you go.
Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.